Situation 1. Jimmy developed this goal for hospitalization. To get a handle on my nervousness, the nurse is going to collaborate with him to reach his goal. Jimmy was admitted to the hospital because he called his therapist that he planned to asphyxiate himself with exhaust from his car but frightened instead. He realized he needed help. Question 1. The nurse recognized that Jimmy had conceptualized his problem and the next priority goal in the care plan is A. Help the client find meaning in his experience. B. Help the client to plan alternatives. C. Help the client cope with present problem. D. Help the client to communicate. Answer: C. Question 2. The nurse is guided that Jimmy is aware of his concerns of the here and now when he crossed out which item from this list of what to know. A. Anxiety-laden unconscious conflicts. B. Subjective idea of the range of mild to severe anxiety. C. Early signs of anxiety. D. Physiological indices of anxiety. Answer: C. Question 3. While Jimmy was discussing the signs and symptoms of anxiety with his nurse, he recognized that complete disruption of the ability to perceive occurs in A. Panic state of anxiety. B. Severe anxiety. C. Moderate anxiety. D. Mild anxiety. Answer: B. Question 4. Jimmy initiates independence and takes an active part in his self-care with the following except A. Agreeing to contact the staff when he is anxious. B. Becoming aware of the conscious feeling. C. Assessing need for medication and medicating himself. D. Writing out a list of behaviors that he identifies as anxious. Answer: A. Question 5. The nurse notes effectiveness of interventions in using subjective and objective data in the A. Initial plans or order. B. Database. C. Problem list. D. Progress notes. Answer: D. Situation 2. A research study was undertaken in order to identify and analyze a disabled boy's coping reaction pattern during stress. Question 6. This study, which is a depth study of one boy, is A. Case study. B. Longitudinal study. C. Cross-sectional study. D. Evaluative study. Answer: A. Question 7. The process recording was the principal tool for data collection. Which of the following is not a part of a process recording? A. Nonverbal narrative account. B. Audio and interpretation. C. Audio-visual recording. D. Verbal narrative account. Answer: C. Question 8. Which of these does not happen in a descriptive study? A. Exploration of relationship between two or more phenomena. B. Exploration of relationships between two or more phenomena. C. Manipulation of phenomenon in real-life context. D. Manipulation of a variable. Answer: D. Question 9. The investigator also provided the nursing care of the subject. The investigator is referred to as an A. Participant observer. B. Observer researcher. C. Caregiver. D. Advocate. Answer: D. Question 10. To ensure reliability of the study, the investigator analysis and interpretations were: A. Subjected to statistical treatment. B. Correlated with the list coping behaviors. C. Subjected to an inter-observe agreement. D. Scored and compared standard criteria. Answer: A. Situation 3. During the morning endorsement, the outgoing nurse informed the nursing staff that Regina, 5 years old, was given flurazepam, Dalmane, 15 mg at 10 p.m. because she had trouble going to sleep. Before approaching Regina, the nurse read the observation of the night nurse. Question 11. Which of the following approaches of the nurse validates the data gathered? A. I learned that you were up till 10 last night. Tell me what happened before you were finally able to sleep and how was your sleep? B. You look like you had a very sound sleep. That pill you were given last night is effective, isn't it? C. Regina, did you sleep well? D. Regina, how are you? Answer: A. Question 12. Regina is a high school teacher. Which of these information least communicate attention and care for her needs for information about her medicine? A. Guided by a medication teaching plan, go over with her the purpose, indications and special instructions about the medication and provide her a checklist. B. Provide a drug literature. C. Have an informal conversation about the medication and its effects. D. Ask her what time she would like to watch the informative video about the medication. Answer: D. Question 13. The nurse engages Regina in the process of mutual inquiry to provide an opportunity for Regina to A. Face emerging problems realistically. B. Conceptualize her problem. C. Cope with her present problem. D. Perceive her participation in an experience. Answer: D. Question 14. Which of these responses indicate that Regina needs further discussion regarding special instructions? A. I have to take this medicine judiciously. B. I no one will stop taking the medicine when there is an advice from the doctor for me to discontinue. C. I will inform you and the doctor any untoward reactions I have. D. I like taking this sleeping pill. It solves my problem of insomnia. I wish I can take it for life. Answer D. Question 15. Regina commits to herself that she understood and will observe all the medicine precautions by A. Affixing her signature to the teaching plan that she has understood the nurse. B. Committing what she learned to her memory. C. Verbally agreeing with the nurse. D. Relying on her husband to remember the precautions. Answer A. Situation 4. The nurse-patient relationship is a modality through which the nurse meets the client's needs. Question 16. The nurse's most unique tool in working with the emotionally ill client is his/her A. Theoretical knowledge. B. Personality makeup. C. Emotional reactions. D. Communication skills. Answer D. Question 17. The psychiatric nurse who is alert to both the physical and emotional needs of clients is working from the philosophical framework that states A. All behavior is meaningful, communicating a message or need. B. Human beings are systems of interdependent and interrelated parts. C. Each individual has the potential for growth and change in the direction of positive mental health. D. There is a basic similarity among all human beings. Answer C. Question 18. One way to increase objectivity in dealing with one's fears and anxieties is through the process of A. Observation. B. Intervention. C. Validation. D. Collaboration. Answer B. Question 19. All of the following responses are non-therapeutic. Which is the most direct violation of the concept, congruence of behavior? A. Responding in a punitive manner to the client. B. Rejecting the client as a unique human being. C. Tolerating all behavior in the client. D. Communicating ambivalent messages to the client. Answer B. Question 20. The mentally ill person responds positively to the nurse who is warm and caring. This demonstration of the nurse's role as A. Counselor. B. Mother surrogate. C. Therapist. D. Socializing agent. Answer D. Situation 5. The nurse engages the client in a nurse-patient interaction. Question 21. The best time to inform the client about terminating the nurse-patient relationship is A. When the client asks how long one relationship would be. B. During the working phase. C. Towards the end of the relationship. D. At the start of the relationship. Answer C. Question 22. The client says, I want to tell you something, but can you promise that you will keep this a secret? A therapeutic response of the nurse is A. Yes, our interaction is confidential provided the information you tell me is not detrimental to your safety. B. Of course, yes, this is just between you and me. Promise. C. Yes, it is my principle to uphold my client's rights. D. Yes, you have the right to invoke confidentiality of our interaction. Answer A. Question 23. When the nurse respects the client's self-disclosure, this is a gauge for the nurses. A. Trustworthiness. B. Loyalty. C. Integrity. D. Professionalism. Answer A. Question 24. Rapport has been established in the nurse-client interaction time. I am committed to have this time available for us while you are at the hospital and ends after your discharge. A. The best time to talk is during the nurse-client interaction time. I am committed to have this time available for us while you are at the hospital and ends after your discharge. B. Yes, if you keep it confidential, this is part of privileged communication. C. I am committed for your care. D. I am sorry, though I would want to, it is against hospital policy. Answer A. Question 25. The client has not been visited by relatives for months. He gives a telephone number and requests the nurse to call. An appropriate action of the nurse would be A. Inform the attending psychiatric about the request of the client. B. Assist the client to bring his concern to the attention of the social worker. C. Here, gives her mobile phone. You may call this number now. D. Ask the client what is the purpose of contacting his relatives. Answer A. Situation 6. Camilla, 25 years old, was reported to be gradually withdrawing and isolating herself from friends and family members. She became neglectful of her personal hygiene. She was observed to be talking irrelevantly and incoherently. She was diagnosed as schizophrenia. Question 26. The past history of Camilla would most probably reveal that her premorbid personality is A. Schizoid. B. Extrovert. C. Ambivert. D. Cycloid. Answer A. Question 27. Camilla refuses to relate with others because she A. is irritable. B. feels superior of others. C. anticipates rejection. D. is depressed. Answer A. Question 28. Which of the following disturbances in interpersonal relationships most often predispose to the development of schizophrenia? A. Lack of participation in peer groups. B. Faulty family atmosphere and interaction. C. Extreme rebellion towards authority figures. D. Solo parenting. Answer, B. Question 29. Camilla's indifference toward the environment is a compensatory behavior to overcome A. Guilt feelings. B. Ambivalence. C. Narcissistic behavior. D. Insecurity feelings. Answer, C. Question 30. Schizophrenia is an A. Anxiety disorder. B. Neurosis. C. Psychosis. D. Personality disorder. Answer, C. Situation 7. Salome, 80-year-old widow, has been observed to be irritable, demanding and speaking louder than usual. She would prefer to be alone and take her meals by herself, minimize receiving visitors at home, and no longer bothers to answer telephone calls because of deterioration of her hearing. She was brought by her daughter to the geriatric clinic for assessment and treatment. Question 31. The nurse counsels Salome's daughter that Salome's becoming very loud and tendency to become aggressive is an A. Beginning indifference to the world around her. B. Attempt to maintain authoritative role. C. Overcompensation for hearing loss. D. Behavior indicative of unresolved repressed conflict of the part. Answer, A. Question 32. A nursing diagnosis for Salome is A. Sensory deprivation. B. Social isolation. C. Cognitive impairment. D. Ego despair. Answer, A. Question 33. The nurse will assist Salome and her daughter to plan a goal which is A. Adjust to the loss of sensory and perceptual function. B. Participate in conversation and other social situations. C. Accept the steady loss of hearing that occurs with aging. D. Increase her self-esteem to maintain her authoritative role. Answer, A. Question 34. The daughter understood the following ways to assist Salome meet her needs in avoiding which of the following? A. Using short simple sentences. B. Speaking distinctly and slowly. C. Speaking at eye level and having the client's attention. D. Allowing her to take her meals alone. Answer, D. Question 35. Salome was fitted a hearing aid. She understood the proper use and wear of this device when she weighs that the battery should be functional. The device is turned on and adjusted to A. Therapeutic level. B. Comfortable level. C. Prescribed level. D. Audible level. Answer, D. Situation 8. For more than a month now, Cecilia is persistently feeling restless, worried and feeling as if something dreadful is going to happen. She fears being alone in places and situations where she thinks that no one might come to rescue her just in case something happens to her. Question 36. Cecilia is demonstrating A. Acrophobia, B. Claustrophobia, C. Agoraphobia, D. Xenophobia. Answer, C. Question 37. Cecilia's problem is that she always sees and thinks negative, hence she is always fearful. Phobia is a symptom described as A. Organic, B. Psychosomatic, C. Psychotic, D. Neurotic. Answer, D. Question 38. Cecilia has a lot of irrational thoughts. The goal of therapy is to modify her. A. Communication, B. Cognition, C. Observation, D. Perception. Answer, B. Question 39. Cognitive therapy is indicated for Cecilia when she is already able to handle anxiety reactions. Which of the following should the nurse implement? A. Assist her in recognizing irrational beliefs and thoughts. B. Help find meaning in her behavior. C. Provide positive reinforcement for acceptable behavior. D. Administer anxiolytic drug. Answer, A. Question 40. After discharge, which of these behaviors indicate a positive result of being able to overcome her phobia? A. She read a book in the public library. B. She drives alone along the long expressway. C. She watches television with the family in the recreation room. D. She joined an art therapy group. Answer, A.